AM 1430 KRGI 105.5 FM. Good morning. I'm Brian Gallagher, another guest in studio prior to our state tournament volleyball coverage. Therese Anderson has come by from Central District Health Department, and we're going to talk about an intersection. Well, first, welcome back.
Thank you, Brian.
How does an intersection figure into this?
So intersections are places where, people collide sometimes.
Unfortunately.
And we're talking about viruses colliding today. So, and this is a forecast. So, we can take action to prevent, just as you can stop at that corner and not hit another car. We're running into problems with COVID because COVID continues to modify its structure and turning to variants. These variants right now are called Scrabble variants, and that's because they have letters like Q and X, which in Scrabble have high value.
Yes, they do.
So we're seeing those come down the pike, not here yet, predicted to be here right after Thanksgiving. We also know that we're seeing a little bit of influenza or flu right now, but the prediction is that it will be a pretty strong flu season based on the fact that we haven't had a lot of flu the last 2 years. And so our bodies are pretty much not going to identify and fight that virus as easily as they might have before. So we're starting to see cases of influenza. And then the third thing is RSV, which is a respiratory virus, most concerning in small children under age 3, and also in adults, especially our senior population or those with underlying health issues. So for all three of these viruses, if they hit us all at the same time, our concern is that we will have increased hospitalization rates and serious illness. RSV does not have a vaccine. There's no vaccine for that. So we just want to be aware of that and be very careful watching our little ones if they start to have a deep cough or respiratory issues, a little bit struggling breathing, need to seek emergency care for those kiddos, or at least call your physician or healthcare provider.
All right, so that one doesn't have a vaccine,
Right.
But you get into flu shots, and those flu shots have been readily available. However, we know that the virus tends to morph every year. It's a little bit different. We've also seen how COVID has changed ever since we started dealing with it almost 3 years ago. So we really have a fight on our hands. How do you see numbers within the area in regards to those who are getting vaccines, the cases? What are you seeing?
Right. What we're seeing right now is a good uptake for the bivalent vaccine, which is the new COVID-19 vaccine, which uses the original strain of the virus and also the Omicron strain. So that should protect people against serious illness and hospitalization. Might not keep you from getting it, but it'll keep you out of the hospital. And that, we say, if you're over age 5 and it's been 3 months since you've had a booster or a COVID shot, or COVID, you really need to get this vaccine. So we have that. We also have flu shots, but we're we're more than a little concerned that for flu shots in our child population, that we've only given about 30% of what we usually give. So we really want to encourage parents, come get a flu shot for your child, for yourself. And while you're there, check out those bivalents and see if maybe we can get them both at the same time. We can even give them in the same arm. We're still getting the vaccine, the COVID vaccine, at no charge. So we have an admin fee that we attach to that and bill insurance if a person has insurance. If they don't have insurance, the shot's free, essentially. And for the flu shots, we have a Vaccine for Children program, so if people feel like they don't have insurance to cover it, we can take care of that as well.
If folks have questions, how can they find out more?
Yeah, you need to stop by and see us at 1137 South Locust, or call us at 308-385-5175, and we'll fill you in on all the details and help you know what vaccines you need and when you can get them.
Therese Anderson from Central District Health Department, thanks for the update.
Thanks, Brian.
Good morning from AM 1430 KRGI 105.5 FM.